My name is Beverly Gorman. I'm the Director of Accreditation for the ICAEL, which is the Intersocietal Accreditation Commission for Echo Laboratories. And we accredit laboratories in the United States and Canada currently. Our mission is to improve health care through accreditation, with the bottom line being better quality patient care. Recently, in June of 2010, the ICAEL standards were revised, and then they went into effect actually December 1st of 2010 is when we started basically enforcing those standards. And for adult transthoracic, it's important to note that it is a recommendation that labs use contrast for suboptimal images. But if they don't use contrast for one reason or another, either the hospital won't purchase the product or whatever, then they have to have a policy in place that actually explains and lays out what other imaging modalities are going to be used to answer the clinical questions. So that's the important part for adult transthoracic. For stress echo standards, it is a requirement. If two contiguous segments aren't visualized using harmonic imaging, labs are required to use contrast. And the board of directors felt very strongly about this because what it does, it takes an undiagnostic, basically useless test that you've put the patient on the treadmill or given them a pharmaceutical, and it takes it from an undiagnostic test to a quality diagnostic test, which it was always meant to be. And what that does, it saves time, money, and the patient can get the results in a matter of a few minutes. They don't have to hang around and have either a nuclear scan or some other kind of imaging. So it saves money, it saves time, and it gets a quicker diagnosis for the patient, which is important.
Tell me about the labs, now that you have the ICAEL standards, if they're not using contrast in their ultrasound, what's the implications?
Well, currently, you know, we're very reasonable at the ICAEL, and currently we don't even actually require them to submit contrast studies right now. That is probably going to change in the very near future, but we like to have laboratories have a chance to read, to digest the new standards, to implement those new standards. You know, it can be quite a task to take a standard like that if you've never done contrast in the lab and implement it. Who's going to start the IV? We have to write a protocol. We have to, you know, it has to go through channels. So currently we don't ask for labs to submit studies, but I see that changing in the very near future. So right now we just encourage them to do it, but in the future it'll be more.
Could it impact their accreditation?
Not right now, because we're not asking them to submit studies, but again, in the future it can, and it also, if they have a random site visit or a random audit, it could impact them. And then we would ask for a corrective action plan. In other words, what they're going to do to correct that deficiency.
Can you comment on the quality of images?
It's outstanding. I've seen numerous studies where, especially in stress echo, where it was totally, in echo speak, it looked like a snowstorm. It was fuzz. And the injection of contrast was given, and it turned into just a quality study, and you could, you know, make the diagnosis right from the echo. So it's huge. You know, it's just a huge impact.